Let's take it forward with our guest this morning now. We've got Dr. Anil Poddar joining us, Chairman and Director of the Interventional Cardiology at the Pari Shoha Foundation in Mumbai. He joins us from Gopar. We'll shortly be joined by doctors in other cities as well. But Dr. Poddar, to start with, how exactly are things looking in Mumbai at the moment?
Yeah, the situation is quite grim now because the numbers have been, escalating quite a lot, and there is a shortage of beds. And as you have been discussing all along, that there is shortage of oxygen and remdesivir, and all those things are going on everywhere. The same things are going on here also. But Mumbai being, a city where a lot of people are, density is very high, so the problems faced by Mumbai are high.
And doctor, can I just say this? Constantly we are looking at the shortage of remdesivir being seen as a really desperate position. In fact, just yesterday we saw the health minister actually put a cap on the pricing of remdesivir as well at the moment. But there's also an alternate lobby at the moment saying that not everybody really needs remdesivir, and that India at the moment just might be over depending on this drug. There is some sort of a panic almost. Could you sort of break it down for our viewers on under what conditions do you really need remdesivir so that the panic among people is not there?
Yeah, true, Sonal. Actually, there is no need to panic. Actually, whatever treatment is going on, other than remdesivir, is also good enough. It is also doing all the job. But, it's a panic basically created by this drug is not there and this drug is only going to work. It's not like that. In few cases, in selected cases, it is required. So there is no need to panic. The other drugs which are acting good enough, and they also can take care of. So there is no need to panic as far as the public is concerned, and they did not run here and there. That's what.
So let's take it from a people's perspective of the moment. Dr. Prashant Saxena, he's the Associate Director and Head of Pulmonology at Max Hospital, Saket in Delhi, is also joining us now. Dr. Sharat Chandra, he is the Professor at King's George Medical University in Lucknow, joining us as well. Dr. Chandra, I have to come to you first. Lucknow is at the moment, from what I'm hearing from my own folks back home, is a complete mess. We know that hospital beds are running short. I personally don't know of a single family there who does not have COVID. That's how bad the situation really is. Could you just take our viewers through why is it that Lucknow is particularly seeing such a strain of virus at the moment, which is taking one and all?
Yeah. Yesterday we recorded somewhere around 27,000 cases in UP, and there are around 6,000 cases in Lucknow. And 120 deaths were reported in Lucknow. The number is really big, and all the hospitals and crematoriums are overwhelmed because of this COVID. And this surge in number of cases probably because of that we are not following COVID appropriate behavior, and something is linked to that double mutant virus also. This is also leading to, because this virus has more infectivity and probably it has more lethal also.
Because what I'm hearing, doctor, is that if one person in the family gets it, almost everybody is getting it.
Yeah.
No matter the isolation that people are trying to at least achieve in Lucknow, no matter how much careful they are being at this point, this virus really, the reproductive factor is really high, the R factor really taking everybody.
The report saying that this infectivity of this virus is around 20% higher than the earlier viruses, which was in 2020.
20% higher, okay.
Yeah. So, and it is more, probably it is escaping the immunity also, because now we are getting more cases which are earlier vaccinated or they had disease last year. They are also getting positive now. So this is the major concern with this double mutant virus. Yeah.
Okay, so either it's escaping almost immunity, one that could be naturally achieved if you've had COVID or if you've been vaccinated, it is still escaping that immunity. This is particularly the trend that has been seen with the UK strain that we've talked about at length as well. That's why you're saying it could be the double mutation in Lucknow really. But Dr. Chandra, at the point it is so difficult to even get a test done in Lucknow. So clearly the numbers also at hand are hugely underreported.
This is correct, yeah. because most of the persons who have mild symptoms, they are not going for reporting. They are not going for testing. The patients who are symptomatic, they are having cough and fever for more than 3 days, 4 days, they are going for testing now. So some private lab says that their positivity is somewhere around 70%, because most of the patients who are coming to the lab, they are symptomatic for last 3-4 days.
They're trying to do whatever they can at home at the moment is what I'm hearing, at least. Dr. Saxena, then can I just get a couple of solutions from you? For those of our viewers watching right now, feeling some symptoms or perhaps who've been in touch with people, not getting hospital beds, but what are the top 3 things perhaps that one can do at home?
I think it's a very valid point, because our healthcare is compromised and you are not getting beds, and testing is also limited. So the best option is, if you are at home and you are a suspect, I would suggest that immediately seek medical attention. There are so many online doctors and clinics and hospitals providing this facility 24/7 now. And because, as I think Dr. Chandra also mentioned, this virus is behaving in a different way. Symptoms are progressive, it is progressing fast, and we have more severe patients coming in within a short span of time. So early and proper treatment is the mantra for this virus. And if you have a proper medical advice, you can then get the goal-oriented therapy, because the evidence-based guidelines, there's slight change as compared to what we were doing previously. And most of the time what happens, people start taking normal cold and cough tablets at home, considering it's a common cold.
That's an important point.
I think that's a big mistake which people are doing. In this epidemic, every fever, every cold, every body ache has to be
treated as COVID till the time you test negative. In fact, let me take it a little forward now. With the amount of false negatives we've had, even in the RT-PCR test, because the new variants, extremely notorious, jumping the RT-PCR test as well, not always throwing results in the first time around. So my 2 bits really for the viewers at the point is, the minute you feel something, isolate yourself, start with medication and COVID medication with the advice of your doctors, and do not rush to the hospital immediately at this point. Symptoms before the test results is what has to be seen.